Bronchial Artery Embolization BAE is a minimal invasive procedure used to manage hemoptysis. Hemoptysis is the expectoration of blood from the respiratory tract. This technique involves selective occlusion of bronchial arteries to control or prevent bleeding from the lung. So what are the indications of bronchial artery embolization? Bronchial artery embolization is primarily indicated for patients experience significant or recurrent hemoptysis. Commonly, underlying causes includes chronic infection, conditions such as tuberculosis and bronchiectasis can lead to abnormal blood vessel formation, increasing the risk of bleeding. Inflammatory lung diseases. Diseases like sarcoidosis can cause granuloma formation, leading to vascular complications. Malignancies. Lung cancer may erode into blood vessel, resulting in hemoptysis. Vascular disorder. Conditions such as arteriovenous malformation can predispose patient to bleeding or hemoptysis. So, what is a procedure? The procedure detail is it is typically performed by an interventional radiologist and involve the following steps. So, first step is vascular access. A small catheter is inserted into the blood vessel, usually the femoral artery in the groin or the radial artery in the wrist. Second step is a angiography. Contrast dye is injected to visualize the bronchial arteries and identify the source of bleeding. In the third step, that is called embolization, once the bleeding vessel is identified, the embolic agent such as gelatin sponge, particle, polyvinyl alcohol particle or metallic coil, they are used to introduce through the catheter to occlude the vessel and halt the bleeding. So, the procedure is done. Generally, it is completed within 1 to 3 hours and is performed under local anesthesia. So, what are the benefits? It's a minimal invasive bronchial artery embolization offers less invasive alternative to surgical intervention, reducing associated risk and recovery time. Effective hemostasis. It provides prompt control of bleeding, which is crucial in acute setting. Potential complications. While bronchial artery embolization is considered safe, potential complications may include 1. Chest pain. It is reported in approximately 24 to 91% of the patient, this discomfort typically resolved within a few days. Dysphagia, difficulty in swallowing. It occurs in about 0.7 to 18.2% of cases and usually temporary. Spinal cord ischemia is a rare but a serious complication resulting from inadvertent embolization of spinal arteries. And last one is a pulmonary infarction. It occurs when the embolization affects the lung tissue, particularly if the bronchial artery is sole blood supply due to existing pulmonary artery occlusion. Advancement in super selective embolization techniques and the use of microcatheters have significantly reduced the incidence of severe complications. So, what is the outcome? Bronchial artery embolization has demonstrated high success rate in controlling hemoptysis with immediate hemostasis achieved in a majority of cases. However, the recurrence of bleeding